Hello and welcome to our fifth and final module of the Global Health Starter Kit, Ethics and Sustainability. This module is designed to be presented in approximately 1 to 1.5 hours and introduces concepts of sustainability and ethical global health programs, including research, service delivery, and training experiences, their potential unintended consequences for communities, and suggested solutions for optimizing positive impacts for all involved through practiced self-reflection and partnership. This module continues to build from prior modules, but it can also be taught as a standalone module. The module supplement form includes 3 recommended pre-readings for students to complete prior to the module session. The supplement form also includes recommended metrics for evaluating whether students demonstrate the learning objectives or not after your delivery of the module, and 3 multiple-choice example assessment questions that correspond to the module. These assessment questions could be administered at the end of the module, or if you're teaching the entire series, the assessment questions from each individual module can be combined and administered as a single assessment at the end. And you may, of course, use the evaluation metrics as a guide to develop your own assessments. To keep the session engaging, this module contains thought questions in the teaching notes that you can pose to your students along the way, as well as a warm-up activity and in-class video. The learning experience is meant to be an introduction only, hence the name Starter Kit. While there are numerous resources and references available about the topics covered in this module, for the purpose of today, we've curated a small sample of high-quality resources to support the learning outcomes with dental students in mind. We encourage your students and you to explore the literature further beyond what is contained in this module. To extend the learning experience, optional in-class activities have been inserted along the way. These learning activities allow for approximately 1 additional half hour of active learning during the module session. Because of the nature of the content of this module in particular, we worked to seek global input and expertise, as you can see by our co-authors, Judith Lasker, Jessica Everett, Irene Adiatmika, Gustavo Bermudez-Mora, and Carl Woodmansey. This module is related to 6 competencies from the Global Oral Health Competency Matrix. While these competencies cannot be met through a single teaching module, this module is working toward competency-based best practices in global health for dental education. We've also included 4 measurable learning objectives written specifically for this module. We've included a warm-up activity to get your students thinking about concepts covered in Module 5. You can present the students with these series of statements and ask them if they agree or disagree with the statement. And so what I do is I have the students stand up and I ask them to decide on their answer for each topic and move to the corresponding side of the room for their selected answer, so the side the arrow is pointing to, right side or left side, and then ask the students why did they choose one or the other and have a discussion. So one, this gets them up and moving, gets them engaged, but also gets them thinking. And to stimulate discussion, this warm-up works best if you have only one rule. Students must select an answer, either agree or disagree. There's no in between. Now, of course, there's no right or wrong answer with these statements, which makes selection difficult. And having students commit to an answer encourages engagement and thoughtful reflection during the warm-up discussion. The overall objective is to get the students talking, no matter how they choose. Thoughtful discussion and reflection during Module 5 is key for successful understanding and developing best practices for students. Their thoughts about the statements will likely evolve as you go through the module, and sometimes I even repeat this exercise at the end of class and see if we have different responses than at the beginning. To begin, understanding the history and roots of global health assists to appreciate current models and methods for student learning, as well as their limitations. In this module, we cover the progression of hygiene and tropical medicine, international health and public health, and how they have evolved into global health today. We focus on 3 common student activities for global health learning in dental education today: research learning, clinical service learning, and experiential learning. Because there is certainly overlap among these 3 kinds of learning, we will focus on some of the unique considerations for each. In this module, research learning refers to systematic investigation of a research question or hypothesis. Clinical service learning consists of providing direct patient care as a student under the supervision of another dentist. Experiential learning involves having a concrete experience related to but beyond content taught within the four walls of the classroom that informs how students may perceive a given concept. So let me give you an example. Students might learn about the social determinants of health in class and then visit a community who lacks running water and learn firsthand from community members how that directly and indirectly impacts the health of their community. Though there are many documented benefits from these learning opportunities, as more systematic research is conducted on the outcomes of global health engagement by students, evidence of unintended consequences is rising, and we talk about some of that. Thus, this module delves into ethical considerations for research learning and clinical service learning. Experiential learning can assist in managing these ethical considerations that arise, primarily because it is structurally set up as a learning experience rather than a doing experience. That being said, with any global health activity, major ethical considerations exist. For the remainder of the module, we focus broadly on ethical considerations for any kind of global health learning model. No matter what kind of global health activities students plan to participate in, they should be familiar with three main ethical considerations: the weight of authority, the volunteer effect, and the burden of hosting. The module then moves on to discuss the importance of honestly assessing one's motivations for engaging in global health learning. Student motivations can set the roadmap for the rest of their learning experience, including the kind of opportunity a student might choose to pursue, the host organization a student selects to work with, and the outcomes from student activities, both in the short and long term. Student motivations generally fall into two buckets: volunteer-centric motivations that benefit the volunteers' goals and interests, and community-centric motivations that ultimately foster positive outcomes for the community. We discuss both and how they can work together to ensure everyone has a positive experience. As students address their motivations, they can then become more critical of the kinds of opportunities they seek and the types of organizations they work with. The module then discusses what we call red flags students can watch for as they consider global health learning opportunities, and tips for avoiding these red flags. Next, the module discusses some green lights students can watch for as they consider global health learning opportunities. These green lights help students assess the sustainability and ethical motivations of host and sponsor organizations providing them with these opportunities. Overall, our aim with this module is to help students avoid red flags and focus on green lights in order to minimize ethical challenges and increase the positive outcomes for both themselves and their host communities in the long term. I hope you enjoy teaching Module 5. It can be challenging to teach, but can also provide students with immediate tools to begin to address the many concepts covered in our other modules. To extend your students' learning experience, please do consider teaching our other modules. And because this is our fifth and final module, I'll leave you with one of my favorite teaching quotes. Teaching is the only profession from which all other professions are created. So on that note, thank you so much for your support of our Global Health Starter Kit, and happy teaching!